Hello. Good evening. My name is Anne Griffiths and I'm the RCN Wales board member and I live and work in Aberystwyth, so I'm part of the Mid Wales group of staff, and there we go, the dogs have started. And the joys of being at home, isn't it? So, good evening and welcome to the Mid and West Wales Hustings, which I have the pleasure to chair. We have 4 candidates here this evening from different parts of Mid and West Wales, and I'd like to be able to introduce them by name, and each one of them will in turn be able to give you a little bit about themselves and to tell them what and who they're representing. So we have Mabon ap Gwynfor, candidate for Dwyfor Meirionnydd for Plaid Cymru. Jackie Jones, who is Labour and is representing Pembrokeshire. William Powell, Lib Dem for candidate for Brecon and Radnorshire, and Charlie Evans, who is here for Conservatives, who represents Dwyfor Meirionnydd. And so without further ado, I'll ask Mabon if he'd like to say a little bit about himself before we start the proceedings for the evening. Just prior to that, in case Mabon would like to speak in Welsh, there is a button on the screen for anybody who's here listening. On my screen, it's in the bottom right. It looks like a little bit like a round globe. It says interpretation on it. If you click on that, then it will automatically translate for anybody who wishes to hear anything else. So without further ado, I'd like to pass over to Mabon, please.
Diolch yn fawr iawn, Anne. Thank you very much am y cyfle I fod yma. Gobeithio bod pawb yn dallt ac yn clywed fi. Mabon ap Gwynfor ydw I, ymgeisydd Plaid Cymru yn Dwyfor Meirionnydd. Dwi'n dad I 4 o blant ac felly wedi cael gwasanaeth nifer o staff meddygol y rhanbarth gyfan mewn gwirionedd dros y blynyddoedd. Mab cyntaf wedi cael ei eni ym Mronglais a'r 3 arall wedi cael ei geni yn Wrecsam yn y Meilor. Yn anffodus cyn y Nadolig, o'n i wedi gorfod mynd ar ferch ganol cadu fyny i'r ysbyty ym Mangor oherwydd wedi cael codwm ar ei phen. Felly, yn ffodus neu'n anffodus, dwi wedi gorfod cael gwasanaeth arbennig, gwasanaeth iechyd genedlaethol dros y misoedd dwytha, fel dwi'n siŵr fod y mwyafrif o bobl yng Nghymru ac yn ddiolchgar iawn am y wasanaeth hynny. Dwi'n byw yng Nghrynwyd, felly dwi reit yng nghanol Gogledd Cymru ac yn gweld gwerth yr ysbytai o Aberystwyth mewn gwirionedd, yr holl ffordd o amgylch y Gogledd i'r Meilor, ac wrth gwrs mae gen i nifer fawr o nyrsys cymunedol yn byw yma ac yn gweithio o'n hamgylch ni, ac felly da ni'n gweld eu gwerth nhw yma hefyd.
Diolch yn fawr, Mabon. Thank you very much.
Diolch.
I'd like to pass on now to Jackie Jones, who will tell us about herself and Labour.
Diolch yn fawr, Anne. Thank you very much, everyone. Lovely to not see you, but see you on screen tonight. Thank you for your time and coming here as well, and thank you for the invitation. I'm representing Welsh Labour in Preseli, Pembrokeshire constituency. A little bit about myself. I've been a university lecturer and professor of law for 26 years as a trade union representative during that time, trying to get better terms and conditions for the workforce. So I'm absolutely on side with unions. They are very, very powerful and indeed absolutely essential. I was also a charity volunteer during that time as well, because I don't like just sitting on my hands doing one job. I like to do many different things. My dad's family's from Langham down here in Pembrokeshire, and I've lived here for a long time and worked in Carmarthen in Dyfed County Council. Well, I wanted to, first of all, because I've only got a minute, I can't say very much. So I wanted to thank you for all the work that you've done over the last year. And of course, before that, it didn't just start a year ago, but in this year, last year in particular, because it's been really hard, especially on nurses, but not just nurses, of course, but all frontline workers. but I know it's difficult. And again, just like Mabon, my family used the NHS a lot because both my parents were long-time illness, and they've used Withybush Hospital for many times. So I think probably the minute is up about that now, I would think. So that's all I want to say to start with. I'll look forward to your questions.
Thank you very much, Jackie. We'll pass on now to Mr. William Powell, Lib Dems, so that he can give us a brief about himself.
Diolch yn fawr, Anne. Thank you very much to you and the RCN for this special opportunity to be with you tonight, and those that visit the webcast afterwards. Well, I'm going to join the two colleagues who've spoken in making a sort of declaration of interest here. If this was a council meeting, I'd be leaving the room. My wife is a member of the RCN and is a nurse of over 25 years standing in the NHS. She was trained on the European mainland within the German Health Service. The ward that I represent in Talgarth on Powys County Council is actually probably the community which is most densely associated with both physical and mental health, because for many decades we had the Mid Wales Hospital at Talgarth. We've got a Bronchlees just up the road, as you're well aware, what was originally a sanatorium, which now looks after people's acute mental health needs, but also multiple other functions, including the vaccination centre. And finally, I suppose my other declaration of interest is that this time last year I was in an induced coma, be looked after by, and I'm not going to well up at this point, but I was being looked after by members of yours and their colleagues in Neville Hall Hospital in Abergavenny in the context of the wider COVID situation. So I've got multiple reasons to be grateful to your union, to your profession, and I look forward to engaging as best I can with your questions this evening on my behalf, but also on behalf of the Welsh Lib Dems. Thank you.
Thank you very much. And last but not least, we have Charlie Evans, who's representing the Conservatives, and we'll hand over to him, please.
Thank you, Anne, for this opportunity. Diolch am y gyfer hwn. Just to convey, this is probably the moment where we will have agreement among us all from the various parties, actually just conveying my personal thanks, and on behalf of the Welsh Conservative Party, for all that nurses do up and down the length and breadth of Wales. You know, you haven't just done your normal job. You know, you've been that support with, you know, people on a ventilator, you know, and providing that end of life care, often where people have been unable to hold their loved ones as they, you know, unfortunately pass away. So it's been a year like no other. I'm a Conservative candidate for Dwyfyn Meirionnydd, big West Walian background, sort of lived in Carmarthenshire, Pembrokeshire, now Aberystwyth, and obviously standing in Dwyfyn Meirionnydd, sort of bridging Hywel Dda Health Board as well as Betsy Cadwaladr Health Board. But I think just as we begin, just a few things just to ponder on, and what we've all got to challenge and all present some visions on. You know, 58% of 58 rather of staff morale, nurse morale has worsened during the course of the pandemic. You know, there are 1,612 nursing vacancies that are still in place, and that's probably an underestimate, and £550 million of money spent on agency staff. Those are just three key statistics, I think, that regardless of party politics, I'm sure we'll all agree we've got to do a lot to tackle that. And I'm just looking forward to re-engaging with your questions, Anne, and the RCN, and thank you ever so much for the opportunity to address you this evening.
Thank you very much. So that's an introduction from all the candidates, and we're about to now start with the quick questions. Nicholas Unwin is the question master, and I'll be handing over to him, and then I will be asking each candidate in turn to give us 2 minutes around their answer to that question, and I've got to be quite strict so that we can get as many questions as we can in, and I will try and shuffle the deck and not ask you all in the same order, so that we get a bit of variety, just like question time. So I think now I'm ready to hand over to Nicholas. If you've got the first question, We're on time at the moment, so let's keep it that way.
And we do have a first question, and it is, a few weeks ago, the UK government recommended to the pay review body that nursing staff in England covered by Agenda for Change should receive a 1% pay rise. How would your party ensure nursing staff in Wales receive the fair and meaningful pay rise that they deserve?
Ooh, right, so I think actually I'm going to go straight to Charlie Evans for that opening remark on that one.
Thank you, Anne. A nice juicy question to start with. In terms of the the 1% pay rise, I would like to say that is a matter for UK government. The nurse pay is obviously a devolved matter. Welsh Conservative, our policy is to wait for that NHS pay review recommendation as a bare minimum, to be honest, in terms of that pay rise. I think we'll all agree that actually nurses do deserve a pay rise, as do paramedics, ambulance workers, doctors, across the broader public sector. But yeah, our position is certainly to implement whatever the NHS Wales sort of pay review comes up with as a bare minimum, and then obviously to focusing on, as well as bringing more nurses into the Welsh NHS as well. So that's the sort of the overall package that we've gone for. But regardless of what the UK government have decided, the Welsh Conservative package is to implement what the NHS pay review recommends in Wales.
Thank you very much, Charlie. Jackie, would you like to follow on with that?
Thank you very much, Nicholas. The 1%, I personally, this is a personal opinion, isn't enough. It's absolutely not enough. That was presented in England. The Welsh Labour position, of course, is to wait for the pay review recommendations, and we'll see what happens with those. As a trade union representative for over 15 years, I also think it is about pay, but it's also about terms and conditions. And if we can do something with the terms and conditions and better working conditions as well for nurses as well as other frontline workers, then that's what I would be in favour and pushing for. That's really essential. More and more, the pressures on work are such that the administrative load keeps people away from the front line and from their activities that they went into the profession for. And I'm sure that's the case for many of the frontline workers and nurses as well. And when it comes to care workers and going into care homes as well as at home, then the time pinch is so fundamental, so difficult and so challenging that it makes people want to leave. And I would like to see something done about those terms and conditions, those that squeezed time being broadened out and being sensible, and time spent on the road going between appointments, etc., that taken into account as well. Also about mental health. So terms and conditions also include better mental health facilities and training, all of those things. I think it's a whole package approach that is really needed. Better procedures, of course, as well. Less paperwork, I would say, or less iPad work, let's say, and more time spent with patients. And I think if we can get that right, then we go some way towards it. Midwives in particular, and some of the student nurses that had to go onto the front line early this year have been hard done by as well. So we also have to think about those who are coming up the ranks and in the pipeline to make sure that we don't lose them prematurely. And those with experience, lots of experience, who are thinking about leaving, we have to ensure that they don't leave because we need them. And it isn't just the last year that caused that, it's also previous years. I think my time's up.
Yeah, it is just about. Thank you. Thank you. So I'm going to go to Mabon now.
Thanks. Yes, to call it a pay raise is quite frankly an insult because it's a real terms cut for nurses. And, nurses have been on the front line over the last year. They're continuously on the front line. The stress levels amongst nursing staff, as people here will know far better than I do, is off the scale at the moment because of the pressures on the sector. So a 1% rise isn't a rise in any way at all, and especially when you see politicians having had an inflation-busting pay rise year on year recently. and then those very same politicians going out and urging people to clap for nurses, and then just offer them a paltry 1% rise. Now, in Scotland, we've seen the Scottish government offer a 4% rise, and I think we should, as a minimum, match that. And yeah, have a discussion with the RCN and with the organisations involved to see what is required for nurses. Because, you know, it seems odd to me that the only people who don't get this are the governments, both Welsh and UK governments, and the health boards, who don't understand why are nurses actually leaving the profession early. We've got more nurses going into training, we've got more nurses applying for nursing posts, but then they leave early. And at the same time, we're spending £70 million a year on bank staff. So we've got to ask ourselves, why is that happening? Why are nurses feeling more comfortable going into an agency? Because, as Jackie said, terms and conditions, you know, it's more flexible working hours, willing to work around the hours of those individuals, and they've got that flexibility, and they feel more valued. So it's about valuing and respecting the profession and the nurses, and that's what we need to do. And by introducing that 4% minimum increase, would show at least that we value them to a degree more than what the government is at the moment, but also those terms and conditions, ensuring the flexibility and the continuous training is needed, so that they feel that they can increase and go on in their profession and better themselves.
Thank you, Mabon. And finally, on this question, it's over to William, please.
Thank you, Anne, and thank you, Nicholas, for the question. It's absolutely correct, as Mabon has said, that we cannot reward nurses with a currency of caring, clapping. Clapping alone isn't enough, and we need, particularly in the part of the region that I know best, in Brecon and Radnorshire, and along the Powys border, we've also got to be aware of the cross-border impacts and the nature of the employment marketplace there. It's absolutely essential that we await the recommendations of the review body, but we cannot come out with something of the scale of 1%, given the extraordinary commitments that we've seen from our nursing profession, particularly over recent times. But as Jackie said, and I agree with her, it's also a matter of showing the wider respect. The terms and conditions need to be appropriate, and we need to improve retention levels, and that's all about feeling valued and respected. But that's in first order, that's got to be in monetary terms, but there are many other aspects that we need to look at, and we need to be particularly alert to the post-traumatic situation that applies to many of the nurses in our NHS setting and elsewhere, that following the pandemic. And I'm aware of people who suffer. People talk about post COVID flashbacks and so on. The nursing staff and people that I know in both in primary care but also in acute care, the kind of impact that they have suffered. This needs to be addressed, and we need to be absolutely clear that we've got support in place. Retention's key, and finally, we've also got to attend to the issue of the departing EU nationals and others from around the world who no longer find Wales, the Welsh NHS and the wider NHS as congenial a place as once they did. We must address that also.
Thank you very much. Some interesting answers there to that first question. So, Nicholas, question number 2.
Question number 2. This pandemic has had a huge personal effect on frontline staff and on all those who have supported them over the last year. I, for one, am very proud of them and owe them a huge debt of gratitude. How can you and your political party ensure that their mental health and well-being is supported and positive mental health encouraged?
Okay, thank you very much. I'd like to go to Mabon first on this one, please.
Wel, dyna chi gwestiwn, hynny ydy, mae'r mi dyn ni wedi gweld yn anffodus fwy o bobl sy'n gweithio yn y sector iechyd yn dioddau o ganlyniad i'r aflan haint yma nag unrhyw sector arall yn y gymdeithas. Ac yn wir yma, yng Ngogledd Cymru, mae hyd at chwarter o'r bobl o'r cleifion sydd wedi bod yma wedi bod yn ymhell rhyw ffordd neu gilydd efo'r sector iechyd. Dyna'r impact mae wedi cael. Ac mae'r, fel ydych chi'n gwybod yn well na fi, mae'r bobl yma felly wedi gweld y dioddefaint, wedi gweld pobl yn mynd yn sâl ac wedi gweld pobl yn marw ac wedi colli eu hanwyliad am gyfnodau maith. Felly, y pwynt cyntaf mae rhaid i wneud ydy cydnabod y gwaith yna mae'r sector a'r staff wedi gwneud. Ac felly, wrth gydnabod hynny, gweld fod angen rhoi'r gofal angenrheidiol ar gyfer iechyd meddwl yn benodol. Dyna pam bod rhaid i ni edrych ar sicrhau y ddarpariaeth orau posib yn fewnol o fewn y staff, o fewn yr byrdde iechyd, fod yna argeiledd yn syth bin ar gael i rywun sydd yn teimlo fod angen gofal iechyd meddwl arnyn nhw, a fod nhw'n cael eu cymryd o ddifri os ydyn nhw'n gorfod cael amser i ffwrdd o'r gwaith. Dyna sydd ddim yn digwydd ar y foment oherwydd fod yna brinder staff a'r pwysau arnyn nhw i fod yn gweithio drwy'r amser, a dyna pam yn bod ni'n gweld nhw'n gadael oherwydd y pwysau yna. Felly dydy'r pwysau yna, fel mae'n sefyll ar y foment, ddim yn cael ei gymryd o ddifri. Dydy trefniadaeth staff gan y byrdde iechyd ddim yn cael ei wneud yn drefnus iawn, sy'n golygu fod gweithwyr, nyrsys yn gweithio canodd o oriau yn ychwanegol yr wythnos yn fwy na be maen nhw fod, a hynny oherwydd y pwysau anferthol yna. A da ni'n gwybod hefyd yma yn y gogledd o ran y bwrdd iechyd, mae rhan o'r broblem, a rhan o'r rheswm pam ar i'r bwrdd iechyd cael ei roi mewn mesurau arbennig, oedd oherwydd y gap yna rhwng y bwrdd a'r ward, bod y byrdde iechyd ddim yn gwrando ar lais y staff, ddim yn gwrando ar lais y hyn oedd yn gweithio. A dyna lle mae rhaid i sicrhau fod polisïau chwythu'r chwiban yn gweithio'n iawn a bod nhw'n cael ei gwrando arno, fod y gofal iechyd meddwl yn cael ei ddarparu lle dydy o ddim ar hyn o bryd.
Right, diolch yn fawr, Mabon. William.
Diolch, and I touched on this to an extent in my earlier answer, and it's absolutely crucial that we are alert to early warning signs of anxiety and mental health issues that can arise from nurses' service, particularly their recent service in the context of what we've just been living through. We need also to look at structured provision within hospitals and other sort of large settings, including larger primary care settings, to make sure that we can introduce initiatives such as mindfulness and other techniques which can help to alleviate difficulties and give people greater resilience. I think that's really important. Also, I know one thing that can be particularly important is the and sometimes there can be tensions between agency staff and regular salaried staff, and we need to address that issue also, because that can sometimes lead to tensions and to people not feeling that they are of equal value, or that they are in the widest sense taking a full part in the structure of services. It's also vital, I think, that we engage nurses at all grades more fully in the decision-making process, because if nurses feel that they're being done to, then that can be very demotivating. And I think that's an important part of the wider respect agenda that we need to develop more fully in the Welsh NHS.
Thank you very much, William. Now on to Jackie, please.
Thank you very much. I'd like to make 3 points on this. First of all, I think the effect, one of the reasons that I left the university sector in 2018 was because of the stress and how it was changing. And I felt that I had done my work after 26 years. But stress manifests itself in very many different ways, and it's very individualistic. So I'm not going to sit here in front of you as a politician and say, we've got to do this, that, and the next thing. But I will say that we have to have a panoply, a variety of different methods to help with all of our mental health and coming out of COVID in particular, but not only because of that, but because of the stress levels having been so high over the years. We need a bespoke system to help at different times, because also just because you're stressed and it doesn't mean to say tomorrow you will try and seek help. It might be further down the line. So it's got to be bespoke to individuals' situations. So that's the first thing. Second thing is the thing that I mentioned earlier about the terms and conditions. We've got to recognize that the terms and conditions have to be better for staff, for nurses in particular. So that I go back to a previous answer that I mentioned before. And then third, I think the institutional, I think there are institutional changes that are possible, I would imagine, if there's a staff forum, a whole staffing forum that talks about the institutional, I guess, mechanisms that make even more stress or cause even more stress within the system that can be changed. And that has to have buy-in by everyone involved as well. So I'm a great believer in works councils, in sitting down between trade unions, between employers and management, as well as in my case, it would be students, but it could be student nurses as well, talking to each other, trying to come up with solutions, because I think together we can do this. And this last year has proven it, especially with the vaccination rollout. And we can do this, we can crack this. And of course, I should say, it's fourth point is investment in mental health, and Welsh Labour has committed to that going forward.
Thank you very much. And finally, on this question, it's over to Charlie, please.
Diolch, Anne. Yeah, I think we need to reflect on probably the tone of the question as well. You know, 70 out of a RCN survey, 76% of Welsh NHS nurses reported increased stress over the last year. 52% are worried about their mental health. The average nurse is working 900 hours a week in unpaid overtime. We've obviously got the significant agency staff issue, and obviously absence levels are running incredibly high at 13% due to self-isolation due to the COVID pandemic. So those are just some of the issues and some of the the problems involved. And it's complicated. It really is complex in terms of what we need to do. So we endorse as a party the RCN's third point of their manifesto in terms of that mental health support for nurses. We believe that is something that needs addressing first and foremost. There is still £500 million of unallocated funding in Welsh government coffers which I think should be used as a priority at the moment for that support, because as we've reflected on, PTSD, the real traumatic experiences that nurses have gone through is really quite shocking, and nurses have seen the worst of that. I echo what William has said actually about mindfulness. It's something that I personally have really taken on board over the last year, and my day job is relatively stressful in a busy supermarket, leading that store, and mindfulness has been incredibly helpful. So we need to see that, I think, really embraced within NHS Wales as a practice. And also as well, just one of the manifesto calls by the RCN about mindfulness pre-16 as well. Whilst Conservatives haven't published our manifesto yet, but I'd like to see mindfulness on the curriculum as well, pre-16, because they are the nurses of the future, people who are pre-16. So I think it's absolutely vital that we really embed these practices and to improve mental health resilience across the board. So that will certainly help in the future. But also then around the nurses point, we are committed to providing 3,000 more nurses. I think addressing some of these gaps. And I don't think the pandemic as well should be used as a bit of it shouldn't paper over the cracks of the Welsh NHS, which I believe has been rather mismanaged over the years. That there are, as I said, a number of vacancies, over 1,000 vacancies that were live. We'll fill those vacancies as a Welsh Conservative government, and we'll actually have 3,000 nurses on top as well. And having more nurses on the front line, I think absolutely will assist in the broader nursing team's mental health as well. But yeah, I think just to package that, as time is probably running out, I think mental health support critically, Anne is nodding vociferously, and number two, more nurses on the front line. Those are our priorities as a party.
Thank you very much. Nicholas, over to you again for question number 3, please.
Sorry, just realized I was muted there. For question 3, we have a question about healthcare delivery in rural areas. We've got, how do you think healthcare services can be supported to deliver care at home, and particularly in rural areas?
Sorry, I had to have a sneeze. Right, so question number 3, I'm going to ask Jackie if she'd like to start, please.
Thank you very much. Well, I'm sat here in Preseli, Pembrokeshire, in the rural areas. I'm on a farm here in the middle of well, near St David's, and certainly it takes about an hour to get to Haverfordwest, nearly. So this is a major concern in the area, and it's recognised as such. So healthcare delivery in the rural area, I think, is about trying to bring care as close to the individuals as possible. So bringing it to people's homes, but having it in a systematic and healthy and obviously safe for staff as well as patients way. So depending on what it is that individuals' needs are, then ensuring that nurses, because we're talking about nursing at the moment, are able to deliver that in people's homes. Of course, we also must ensure that the nearest hospital, in my case, it's Withybush Hospital, has the right equipment and it has the connectivity to provide the right kind of care when people are going out and about in the rural areas. So you have to have the right equipment. So having e-prescriptions, having everything online that is possible to have online, as well as the technology that will help with diagnosing the individual ailments, if you like. Video consultations, of course, are also really, really important in rural areas because, and more so now than ever, we've seen that. And we have to invest in those. That is also a particular kind of training, and there's a safeguarding issue there too that I want to draw attention to. Trying to train more nurses in modern nursing practices is vitally important, not just about being on the wards, but also being on the road, if you like. Prioritizing vulnerable patients is also key, as we saw during the pandemic and also before, that it's vitally essential that we get to vulnerable patients in a timely manner. So we've got to have the equipment, the right equipment, and invest in those. And then finally, a hybrid kind of system where health and social care provision makes sure that no one is left behind. The nursing and other provision in the rural areas has to be bespoke to the individuals and the particular timescale that they're in at the time. So if it's something that is really, really serious, such as my mother had motor neuron disease and needed specialist care, for example. My father had liver disease, so he needed specialist care. So those things may not be able to be taken care of in the community. They might need specialist care further up the line. But ensuring that we are able to have a whole system approach that is built around the need of the patient is absolutely essential, regardless of where they're located.
Thank you very much, Jackie. Over to Charlie now, please.
Tell you what, this unmuting malarkey doesn't get any easier, does it? In terms of rural, healthcare, I think Jackie's made some good points. Unfortunately, even in places like Pembrokeshire, for example, a dark cloud, however, has hung over the future of Withybush and Haverfordwest, in Glangwili Hospital in Carmarthen. Vascular services were removed from Ysbyty Gwynedd, for example. Ysbyty Bryn Berel outside Pwllheli couldn't resource the hospital over the Christmas period, but even in urban areas such as, well, I say urban in terms of well standards in Cwmbran, the Grange, again, we're recommending that some patients don't come in unless it was sort of life-threatening. But even on a primary healthcare basis, I can frequently talk about within Aberystwyth, issues where it has been really hard to see a GP face-to-face. And I understand that we're trying to minimize contact and so on and so forth, but I don't think we'd see that if we were living in Cardiff, for example. I've lived through the health services in Cardiff, for example, and the resources have genuinely been much better there as well. And obviously, so yeah, look, I think ultimately, we have seen that decentralisation of services in Betsy Cadwaladr, in particular, with plans down the line within Pembrokeshire and Carmarthenshire as well. And I don't think that is necessarily a strong model. Of course, you've got to have those specialist fields and where people will travel a little bit further. But just if we think about communities in Aberdaron, for example, which is in the corner of the Llyn Peninsula, now they have to travel to Glenclwyd Hospital to get access to those vascular services as opposed to Bangor, which is a significant increase in travel time. So yeah, we've absolutely got to see that that leveling up, I guess, in terms of rural and urban areas in particular. And even in Paris, for example, Paris is a very, very broad. I'm sure William can sort of testify to that. Paris is absolutely massive. And we're having to see a lot of our patients traveling to Shrewsbury, for example, so we need to see services in Paris beefed up as well. And then topically, and then I guess with COVID, for example, with long COVID, there's some fantastic facilities in the Gwent, for example. Long COVID affects people in Dyfed-Powys, in Gwynedd, just as much as it does in the southeast of Wales, for example. So we absolutely need to see those services. But crucially, it's the vacancy issue, in my opinion. We're struggling to attract doctors and nurses to come to Mid Wales, the northwest of Wales in particular, and even Pembrokeshire. So it's absolutely vital that we have those incentives within our education system, whether that's bursaries, whether that's tuition fee exemptions or some sort, or loyalty bonuses to recruit doctors and nurses into these areas. Because I don't think this is deliberate, by the way, by the Welsh Labour government. I really don't actually think this is the case. I think it's due to the vacancies. The vacancies are there, the funding is there, but it's an inability to recruit doctors and nurses and so on and so forth. I think those are the real challenges on the point of rural healthcare and getting back into the community as well. Stop centralising things, decentralised model, ensuring that local community services are there at the heart of local communities.
Thank you very much. William, would you like to follow on, please?
Thank you, Anne. I absolutely agree that that we need to develop further the idea of localizing services, and I think we need to recognise actually where there has been some improvement, because when I was Assembly member for Mid and West Wales between 2011 2016, there was still very much a mindset within management, within the two principal health boards that cover this terrain, particularly in Hywel Dda. We had a situation where we had people helicoptered in senior management positions who were effectively who were wedded to an urbanizing model. We've also seen that in Powys over the years. We've now moved to a better situation. I think that, and that personalising things particularly, I think in Steve Moore and in Carol Shillabeer, our two chief executives, we have a much greater empathy than we had in a previous time. That said, we need to take it further, and that needs to be something that we emphasise. One thing that we've achieved a considerable amount of in the Powys context is repatriating services, for example, renal services, ophthalmic services, and so on, to give a real meaningful life to the cottage hospitals and the other important centres, such as in Llandrindod, in Brecon, in Welshpool, so that renal patients don't have the indignity and the discomfort of having to travel significant distances to get their vital services, and so on with other areas. This is important. It's interesting that what Charlie said with regard to primary care, because I've of course to be enormously grateful and far more aware than ever I was until around this time last year of the incredible value of the district nursing service, and that is vital. But I'm getting quite a lot of concerns raised with me at the moment about the barricading off of primary care, and I'm sure that this isn't something that is pleasing or that is acceptable to the doctors and the district nurse team. But at the moment, the patients out there, many of whom have been sitting and festering away with illnesses and conditions that are not COVID related but are lockdown related, they desperately need to get attention. And at this moment, people are not feeling that ability to access. And I think we need to, through a whole range of strategies, to make those services more accessible. Because if we don't, there's going to be an additional acute crisis. And that's why it's so important that we get it right, and particularly for our deep rural areas.
Thank you very much, William. And finally on this one, Mabon, please.
Dyma ydy'r cwestiwn mawr sydd yn wynebu'n cymunedau gwledig ni, hynny yw edrychwch ar ardaloedd fel Dwyfor, Meirionnydd, fel Ceredigion, fel Powys, wch chi cymunedau sydd yn bell o'r gwasanaethau hynny, a mae yna wendid a methiant polisi wedi bod fan hyn, o dir Llywodraeth ag o dir Byrdde Iechyd, lle fel ar ei bil ddeud ynghynt, lle da ni wedi gweld unigolion yn dod ac yn gorfodi polisi trefol a dinesig ar ardaloedd gwledig. Ac nôl yn 2013, oherwydd hyn, efo polisi o gau ysbytau cymunedol, ddaru fi a criw o bobl sefydlu Cyngor Iechyd Gogledd Cymru, mwyn gwrthwynebu'r cau ysbytau cymunedol yn Blaenau Ffestiniog, yn Llangollen ac ym Mhrestatyn, oherwydd yn bod ni yn cymunedau gwledig ni yma yn gweld gwerth y gwasanaethau yna, yn gweld gwerth cael gwlau cymunedol. Mae yna ei ofn fod o'n mynd yn ôl felly at yr un ateb a be da ni'n mynd i gael bob tro am hwnni, sef diffyg staff, diffyg nyrsio, staff nyrsio. Yr hyn oedd y Bwrdde Iechyd yn deud wrthon ni bryd hynny oedd bod nhw'n methu cynnal yr ysbytau cymunedol yma oherwydd bod gynnon nhw ddim y staff mwyn cynnal y gwlau. Ond i'r staff ddim gynnon nhw oherwydd bod nhw ddim yn eu cyflogi nhw. Da ni'n gwybod, mae hyn di bod ar y cardiau ers 2011, oedd yr RCN bryd hynny yn rhybuddio o ddiffyg niferoedd nyrsio. Da ni'n gwybod ers blynyddoedd maith o hyn yn dod. Ag canlyniad hynny ydy bod gwlau yn mynd ar goll. Da ni wedi gweld ers 1989 enghraifft haneru y gwlau ysbytau sy'n gynnon ni, sy'n golygu fod fwy o bwysau ar ysbytau cyffredinol. So it's the same answer as we're going to get every time, the need to train and recruit more nurses. That's why, we've promised that we would recruit and fund 4,000 more nurses. And part of that package, incidentally, as well, is not just nurses for the district general hospitals, but community nurses as well. Nurses that work within the community, that live within the community. And we're also seeing a serious lack in community beds for things like rehabilitation. That's why we're campaigning now for an improved Penrose service. That's why we're calling for more services in rural areas like Meirionnydd, Ceredigion, Pembrokeshire, so that we've got those community beds with the nurses to support them as a step up and as a step down. To allow people to come closer to home, to get that respite, to get that rehabilitation as well. So that's what we need. We know what the problems are. You know better than we know what the problems are. It's not necessarily the funding that's the problem. It's the wrong policy model that's been enforced on us. We can learn from Scandinavian countries. We can learn from New Zealand and Australia, and even the United States, countries with large rural areas that have adapted and adopted new technologies, like we've touched on with having used Zoom and Teams and things like that for these purposes. We can learn from those models. That's what we need to do, is adopt those models for our communities as well.
Thank you very much, Mabon. So now, Nicholas, question 4, please.
Question 4, and it is we've had quite a few questions come in about recruitment. So how would your parties recruit more nurses to fill the 1,600 nurse vacancies in Wales?
I think I'm going to take that to William first this time, please.
Thank you, Anne. We recognise the absolute priority of making the Welsh NHS an even more attractive place to work. And I referred earlier to the fact that we're acutely aware, certainly in this part of the world, in this part of the Mid and West region, of the wider impact, and therefore we need to ensure that we're not having any significant leakage cross-border, that both within the remuneration package, but also critically within the sense of the wider package of conditions and benefits. That is one of the key things that we see as being a tool for doing that. But there is also the wider dimension of the other living costs and the nature of the communities in which these nurses to be recruited will be living. So there is a linkage here between health and social care policy, but also other areas, critically the affordability of housing and the availability of quality local schools as well. So I realize that might seem to be a second order issue, but in fact it's pretty important to ensure that you've got the combination of public policy to make sure that you've got an attractive offer. And one thing that has been particularly difficult, and Welsh Government, I will pay tribute to Welsh Government in this regard. They have made a much more vigorous effort to ensure that those health service staff who are EU nationals and others legally present within the UK and contributing and paying tax are fully valued, and the fact that they have the opportunity to cast a vote in the election in which we're all engaged is really important. But we need also to up the way in which that respect and that regard in which they're held is communicated, and I think we can never do that strongly enough. So it's a matrix of things, starting with pay, then conditions, but also the way in which we make them feel valued and have an opportunity to have the fullest and most rewarding wider life. And that's very much in the context of the Future Generations Act, which I think is critical here in decision making going forward.
Thank you very much, William. Over to you this time, Mabon.
Right, well, I'm fairly proud, I must admit, to have played a small part in the improved situation regarding nursing at the moment, because a couple of years ago, some nurses approached myself concerned that Glyndŵr University wasn't accredited with the Welsh Government for nurse training in Wales. So what happened there was that nurses being trained in Glyndŵr University more often than not went over to the private sector or went over to NHS boards in England. So we applied pressure on the Welsh Government successfully, and now Glyndŵr University, they are accredited by the Welsh Government, and they do train nurses for North Wales, which is fantastic to see, and they're amongst the one of the best in the UK for nurse training. Also, 20 years ago, Plaid Cymru were calling on Bangor to have a medical school, and now 20 years later, at last, the Health Board have said, yes, this is what we need, and the Welsh Government have accepted and admitted that we need a medical school for North Wales. So that's something else we'll be pushing on and making sure that is realised. But it's more than just the recruitment, because as we touched upon earlier, we are seeing more nurses being trained now. We're seeing nurses apply for these posts. So it's not necessarily just to do with recruiting, it's probably more so to do with retention. And we touched on this earlier as well. So I think the question is, yeah, we need recruitment of new nurses so that they come through the system, but we need to retain the nurses that we have so that they don't go into the agencies, or that they don't go into the private sector or move on to other careers. And that's about valuing nurses by giving them the proper pay, by giving them the proper terms and conditions, and by ensuring that they have a career pathway within their nursing careers, so that they know that they can improve and get lifetime training free of charge, so that they can improve their skill sets throughout their career as a nurse.
Thank you very much, Mabon. Over to Charlie now, please.
Thank you, Anne. And I agree with what Mabon had a lot to say there about retention. Actually, in terms of Welsh Conservative government, what we'd be implementing a recruit, train, and retain scheme, which we'd be looking to pilot, among other things, a nursing apprenticeship degree pilot scheme, which would be more vocational in nature. And we believe that the contents of that course could really, attract some new people into the course. I think William made a comment about, people potentially going over to the border, and this is linked, I guess, to what Mavin was just talking about, the overall package. Of course, it does work both ways as well, and currently there's quite a lot of bureaucracy around, people moving across nations in terms of working in and even between health boards. And actually what we need to see is to see some of that bureaucracy come down to allow people from England as well to come and work within the Welsh NHS, which does happen, but I think that is something that can be explored further. And I think, actually I'm all for a bit of a bit of healthy competition, actually, to encourage, if the Welsh NHS is more desirable to work for, I think we'll see more nurses from England to come into the health service. And also as well, a fellow panelists recognise the contribution that nurses from around the world have made, and absolutely as part of the immigration system going forward, it's imperative. And I believe that this is protected, by the way, that my fiance is Polish. I absolutely recognise the contribution that European people make, and people around the world, and it's absolutely vital that we still have nurses from across the globe come to our health service and work for us. So whether they're England, whether within Wales, whether across the world, it's absolutely vital that we have an attractive package. And we have an attractive package, and but everything at the moment in terms of morale, training, only 24% of training requirements are being met over the last year with NHS Wales compared to the wider United Kingdom, which is in the high 50s. The whole package has to be attractive to bring nurses into the NHS, to make it more desirable. But yeah, more detail will be coming out in the Recruit, Train, Retain programme in our Welsh Conservative manifesto in the coming weeks. But rolling out that nursing apprenticeship degree pilot, is quite an exciting initiative as well. So yeah, I hope that relatively answers the question.
Thank you very much. Finally, Jackie.
Thank you, Anne. Some of the points have been raised already. So when we talked about terms and conditions of work, those are really, really vitally important in order to retain and to recruit individuals into the nursing profession. And I'll sort of keep my comments to the area here in Preseli, Pembrokeshire, or around here in Pembrokeshire. And because there are different pressure points in different parts of Wales. And we're talking about Mid and West Wales. I think it's a holistic approach that we need. And that is not just about pay, of course, and an increase in pay, better terms and conditions, but it's also about, why does a family, for example, or a young couple or a young person want to move within a different area or stay in their area in order to have their profession? So do they have access to good quality housing? Well, Welsh Labour is building council houses and affordable housing. Are they able to afford it? Can they rent places? So again, Welsh Labour is investing in that. Are they able to have good schools around them where their families can have prospects for the future? And again, Welsh Labour is investing in that too. Are they good? Is there a quality of life in the area that they're trying to move to or remain in? I think when it comes to the rural areas in Wales, I think there's definitely a quality of life. And we've seen that with other places in the UK, certainly people from the London way trying to come down to rural parts of Wales and Cornwall, Devon, etc., to buy houses because they recognise that a lot of things can be done online. So can there be enough space for families and for individuals in order to do that? We've got to do more for that. I'm very delighted that Pembrokeshire County Council Labour councillors have initiated a call to 100% uplift in second homes for the council tax, for example. I think that those kind of initiatives are really important, or community housing projects, cooperatives and mutuals, really important. In short, I think we need to invest in the community, not just in nursing, but also in nursing, of course, as well. All of those things. I also think in the recruitment itself, what that looks like should be modernized too. How much diversity is there within the nursing recruitment? How much flexibility is there? And how much flexibility can there be in the working practices as well that is fit for the 21st century? So I think there are quite a lot of things that can be improved. And it's not just about investing money, but it's also about mindsets as well. I think COVID has proven that the mindset of individuals has shifted, and people have taken a step backward and they thought, right, where do I want to be? What do I want my life to be like? Not just now, but in the future. And what's my life going to be like? Or what's my children's life going to be like? So they also think about climate change, for example. So all of those things come together in order to have a whole package of measures that we're looking at in Welsh Labour to do better for the future, coming out of COVID and recovering from COVID. Thank you.
Thank you very much. Where did Nicholas go from the top of my screen?
I'm still here.
Oh, there we are. We're ready. We're ready for another question, please.
So next up, we have all of the speakers have talked about the need to value nurses in the NHS. But how would your parties ensure that nurses not working in the NHS, for example, those in the independent and social care sector, feel valued?
Right. So we're going to go to Charlie first on this one, please.
That's an excellent question. And obviously, the RCN represents, nurses, across public and private and, the independent sector alike. And I think what's really, really quite important, I guess, is when we're, us in the political world, when we're having a conversation about agency nurses, but, bank and things like that, that we don't at the same time disparage people within that agency nurse sector at the same time, because they obviously have an incredibly valuable contribution to the Welsh NHS, and it's not the fault of agency nurses that the package within the sort of the mainstream NHS is not as desirable as it sometimes is to work as an agency worker. So I think it's really, really important that our language, I think, is reflective of that. Actually, we're not looking to disparage people who work outside the NHS. In fact, the agency workers do have a part to play, and they have had a part to play during the last 12 months, in particular during the pandemic. So I think that's absolutely vital. I think that's obviously the more broader point on the matter. Obviously, Welsh Government have far more control on the matter of sort of the mainstream NHS conditions for nurses as opposed to people working independently. So I think it's one of tone and language, and actually we have that inclusive debate and inclusive discourse around the contribution that all nurses play, regardless of how they perform their work. I think that's absolutely vital.
Thank you very much, Charlie. Jackie, we'll go to you again on this one now.
Okay, thank you very much. Again, I come back to my trade union roots. I do think that it's absolutely vital that all workers, regardless of their status, are protected, whether they're in precarious work or not. And certainly as Welsh Labour, we would like to see them not be in precarious work at all. So when it comes to private care providers, they are also covered by the national workforce strategy that will be coming online if we are returned as a government next in May, not long now. The Welsh Labour government has committed to investing in the workforce so that you improve the public provision of mental health and wellbeing services. We're talking about therapies and therapists and rehabilitation and public health but it also includes targeting training for staff employed by social services departments, NHS, but also private care providers, which at the point is at the point of need and is cost neutral to the employee and can be delivered in their working hours. So the Welsh Labour government has recognised the need in order to also provide for independent sector and have them be valued as well. I personally would like to see them incorporated in all of the facilities and the ideas that I've put forward today for a holistic approach, for better terms and conditions. I personally, again, I'm talking personally, would like to see them be inside a union, of course, and be able to be part of the overall strategy to create much better and fairer working conditions and equal pay for all workers across the sectors. I know that sounds a bit grand, but that's what I fundamentally believe, and that's what I spent 20-some years practicing as a legal academic, talking about discrimination law and getting rid of the discriminatory aspects of different parts of the systems that exist and doing equal pay audits. I think it's absolutely vitally important that people are not exploited, whether in the private sector or in the NHS. And that has to be one of our priorities going forward if we're returned in May.
Thank you very much, Jackie. Mabon, over to you.
Diolch. Thank you. Eto, mae'n un arall o'r cwestiynau yna sydd yn deg iawn a mae pobl yn disgwyl atebion, ac felly mi ydyn ni fel plaid, os gai fynd gam ymhellach na dim ond sôn am strwythur staffio, mi ydyn ni fel plaid wedi sôn am greu gwasanaeth gofal cymdeithasol cenedlaethol ar yr un model a gwasanaeth iechyd genedlaethol. Mae hynna'n golygu fyse gwasanaeth gofal am ddim ar y pwynt o angen ar gyfer y bobl hynna. Mae hynna'n gwneud synwyr oherwydd mi ydyn ni ar hyn o bryd yn gweld pobl yn gorfod gwerthu tai, enghraifft, yn gwerthu eiddo mwyn cael gofal cymdeithasol. Dydy hynna ddim yn deg. Felly, os ydyn ni'n derbyn yn bod ni'n mynd i sefydlu corff o'r fath, ac yn bod ni hefyd yn dadlen ddigon teg fod angen uno gofal a iechyd, yna mae'n sefyll i reswm fod angen i weithwyr yn y sector gofal fod ar yr un telerau a gweithwyr yn y sector iechyd. Bod nhw'n cael yr un telerau ag amodau gwaith ac felly ar yr un pay scales. So if we accept that Plaid Cymru, we're arguing that we should have a national care service like we have a national health service, because it's wrong and immoral at the moment that people are expected to sell their homes, for instance, in order just to pay for their end-of-life care. If we think, and a lot of people have argued this, and we would, for instance, join and merge social care and the health service, if we accept that's needed, then it stands to reason that the staff within social care need to be on the same terms and conditions and on the same pay scales as staff in the health service. And that's what we would do, simply.
Thank you very much, Mabon. Last on this one, please, is William.
Thank you, Anne. I think this is probably the right time to refer to and to acknowledge the work that Kirsty Williams has carried out over many years, particularly in the Fourth Assembly with RCN and other partners in terms of winning support for the Safe Nursing Standards legislation, which was enacted in 2016 as private members legislation, but with Welsh Government support at the time, because we need to extend that to other settings, including community settings, because it's absolutely vital that nurses have that opportunity, whether they're operating on wards or in other situations. And I think that's something that I definitely need to acknowledge, and the Welsh Liberal Democrats are committed to taking that a step further within the period of the Sixth Assembly, or the sixth of the new Senedd term, and I think that's vital. Also, Mabon has quite rightly related to the issue of a sort of levelling up between health and social care, and that's something that is critical. In the context of this part of the Mid and West Wales region, in Powys, we happen to have a situation where the health board is co-terminus with the local authority, and so we have an opportunity here to revisit that initiative in a more convenient way, and to use that as a setting for taking this forward, because it isn't about artificial barriers, and it's certainly not, as Charlie said, about the stigmatization of particular categories of workers, but they need valuing, and they need to realize that they're playing a vital part. And one of the things that will ensure that continues to be the case is their opportunity to have full rights and to have their needs represented within the decision-making bodies and through yourselves as the RCN and other partner unions that protect their rights and ensure that their needs are fully understood at government level. And that is hopefully a part that some of us will be playing as well.
Thank you very much, William. We have around 10 minutes left to go. So, Nicholas, is this likely to be the last question, or do you want us to see if we can do it a little bit quicker and get 2 in?
Always like more questions. If we can fit 2 in, that would be best.
Okay.
But we'll see how it goes.
Yeah, thank you.
So next up we have a nice simple one. Do you support the extension of Section 25B of the Nurse Staffing Levels Wales Act 2016?
Right, going to start here with Mabon then, please.
Wel, yn gyntaf i gyd, mae'n siŵr fod Bill wedi bod yn rhan o helpu Kirsty Williams, a mae wedi ateb y cwestiwn yn barod, chwarae teg iddo fo. Mae wedi sôn mewn ffaith fod Kirsty wedi sefydlu'r y ddeddf yma i sicrhau fod nifer staff diogel gynnon ni, ac felly ymestyn hyn allan i'r gymuned yn sicr. Mae Bill wedi ateb yna, dwi'n credu fydd neb yn angytuno, yn sicr mae angen gwneud hynny. So I think, personally speaking, Bill Powell's answered this on behalf of most of us, or all of us, hopefully, that, yes, certainly that needs to be done. You know, I'm sure Bill was part of helping Kirsty out, because I know they've worked closely together over the decades in ensuring that that legislation passed. And again, it stands to reason that it needs to be expanded as well, so yeah.
Yeah, thank you, Mabon. Jackie, your views?
Very quickly, yes.
Excellent. So at this rate, we'll probably get another question in. So I'm going to pass now on to I've lost my thread. Charlie, please.
Thank you for that one. Just broadly around the the safe and the effective nursing care point of view. I think I mentioned earlier about the training disparities between Wales and the rest of the United Kingdom as well. So we've got to absolutely address those sorts of problems without advance viewing of my party's manifesto, because that is to be published in the next few weeks. I certainly would personally like to see the extension of that section of the Nurse Staffing Levels Act.
Thank you. And finally, William.
Sorry, I had a sticky mouse there for a moment. Apologies. Mabon was right in anticipating my answer. Absolutely, yes.
Thank you very much. And that allows us, Nicholas, to go for another question, please.
Excellent. So for our next one, and possibly last, we'll see. We've had quite a few questions coming in on pay all evening. So I'd like to just come back and ask, do you support the Royal College of Nursing's Fair Pay for Nursing campaign, calling for a 12.5% pay rise for nursing staff?
Right, okay. I'm going to go to Jackie first on this one, please.
Well, I think we've all answered it in our own way, that we are, I believe so anyway, that we have to wait and see what the review says, the independent review says. So I can't commit to that on behalf of the Welsh Labour at all, because I simply can't. And Charlie made a very good point about waiting for the manifesto as well. So on a personal level, of course, I would really like to see the best pay rise we can possibly afford. And I know that when it comes to when I was a lecturer, our pay went down. And when I looked at the graph within the manifesto that is contained within it, I noticed so many similarities, and the number of people who left because the pay was getting so bad, and also the terms and conditions. And that's why I mentioned the terms and conditions as well. So if there's any money left over of that imaginary 500 million that Charlie was mentioning, I don't know, but we'll see what the Johnson administration hands down in the near future as well. So I would like to, on a personal level, yes.
Then thank you very much, Jackie. I can't remember. Oh, Jackie was the first one, that wasn't she? So, Charlie, please.
Hello. Thank you for the question. Look, I personally, or the party, can't support a 12.5% pay increase. Unfortunately, I think we all recognise across the panel that we need to do a better job of recognising the value and the contribution that nurses pay. Of course, we've got to wait for that. If the pay, we've promised to implement the pay review recommendation. If that is 12.5%, of course we will. I can't envisage a situation where they would recommend a 12.5%, but we'll wait and see. But look, I think, broadly speaking, it's a very, very difficult situation. There's obviously a public sector pay freeze across, other public sector professions. And I think if we're freezing that level and then to implement a 12.5% increase in terms of nursing pay, I think that would be, hard to justify. So I hope I'm, being straight up with that answer. But we've got to look at that broader package that Jackie and I think all of us have discussed as well, however, to make nursing more rewarding beyond pay as well.
Thank you, Charlie. William.
Thank you, Anne. On a personal level, for all the reasons that I mentioned in my declaration of interest at the start of this excellent set of hustings, I would wish to support that. Absolutely, I would wish to support it. I think we do need to await the outcome in terms of the recommendations of the pay review panel. Which my starting point is certainly at the 1% cap is derisory and insulting, and not an acceptable recognition of where we are and where the nursing profession has been in the past 12 months and more. We also, I think, have got in common ground around the virtual panel table this evening the sense that we need to have an enhanced package, which includes terms and conditions and guarantees, as well as continuous professional development and the extension of the safe nursing standards legislation. So personally, I would wish to. My party has made its own difficult experience of making pledges in the past that have come back to revisit us in a difficult way, and I can't make that commitment tonight on behalf of my party. My personal commitment is beyond question, and we must raise our game in this regard and recognition of what your profession does for our quality of life and for us in this nation. So thank you very much, and thank you for the opportunity to be part of this session this evening.
Thank you, William. And finally on this question then, Mabo.
Wel, ylwch, da ni wedi trafod yma drwy'r nos heno wan yn do am y drafferth efo recrwtio ond yn benodol cadw staff ag pam bod ni'n methu cadw nyrsys oherwydd nad ydyn nhw'n cael I parchu yn iawn. Da ni wedi dod i'r casgliad yna, mae'n berffaith amlwg I bawb weld, ond eto, gweitha hyn, mae pawb yn ofni sôn am roi tal teilwng ymgylchiadau gwaith teilwng I nyrsys. Mae'n rhaid I ni, beth bynnag mae'r adolygiad annibynnol yn ddweud, mae'n rhaid I unrhyw lywodraeth yng Nghymru sicrhau bod nhw'n agor y drws yn llawn i'r RCN a'r undebau mwyn cael y drafodaeth yna. Nes I sôn ar y cychwyn, beth bynnag arall, mae'n rhaid ni gael y 400 yna o gynnydd sydd yn dangos cynnydd go iawn, oherwydd mae y sector yma wedi gweld toriad ar ben toriad go iawn dros ddegawd, ac felly mae beth bynnag 400 yna yn mynd i fod yn gynnydd o dan y blaid, ond mae rhaid felly i ni agor y drws a gwrando, oherwydd o ddarllen papurau yr RCN, mae yna ddadl teg yna. Mae yna ddadl teilwng cael ei roi ger bron pam dyle hyn ddigwydd, ac felly dyna pam dyle'r Llywodraeth wrando. So, you know, we've identified the problems. We know why there's a problem with retention of nurses, and it's because nurses don't feel valued, because they're not respected. And if we accept that, and I think we've all accepted that tonight, then we need to take the steps in order to ensure the retention of nurses and ensure that they are valued. So that means a lot of that is ensuring that they get a fair pay, because they've had year on year cuts, real-term cuts, for the last decade or more. Now that means, as far as we're concerned, yeah, a minimum of that 4% pay rise as a minimum, but then opening the door and ensuring that the government listens to the RCN and the unions so that they can put their compelling case forward, so that the voices of the nurses is heard in the powers, or in the corridor of powers down in Cardiff, and that they are listened to.
Thank you very much, Mabon. It's now, by my time, 19:16, so just after 7:15, and I think that sees us with the conclusion of the questions. Is that correct, Nicholas? We're now going to go into an animation regarding the safe and effective care. And what I'd like you all to do to be able to see this is to put your video off, and then we'll watch it, and then we'll come back at around 7:20 following the animation. Thank you very much. I think I'm back. Are we all back? There we are. Well, I must admit, I think that this evening has been very, very interesting. And what I'd like to do now, before I go much further, and the dogs are here now, is to thank all the candidates that have been here and given up their time tonight to sit and participate in this question time. And also to say that that the RCN are hosting a number of other regional hustings, and on the 22nd of April, hoping to be hosting a national hustings with the party health spokesperson. So I think that is something that's very interesting, and I found it a different format and a different way of undertaking things. So before we finally close, I'd like to ask each and every one of the candidates to give us a few closing remarks. You've got approximately a minute each, and I think we'll start this time with Charlie.
Flipping heck, a minute isn't long enough, but there we go. Just to say, big thank you for this evening. I've thoroughly enjoyed the cross-party approach, by the way. If only politics could be more like this in future. But it's not about us. It's about nurses up and down Wales. It's about your members, RCN, and those 5 points in your manifesto. We're absolutely, as a party, committed to delivering, perhaps not in exactly the same ways as you're calling for, but those 5 broad points we absolutely agree with. And I think that point about valuing nursing has come through loud and clear. But just a quick message on behalf of my party, just to say, we are indebted to you, nurses. We are indebted to you, RCN members. We're indebted to you, RCN. Thank you for putting on this event, and I'm looking forward to doing this all again in person now at the end of what these sort of restrictions are in sight. So yeah, diolch yn fawr iawn I chi, and nos da.
William, we'll go to you next.
Thank you, Anne. Well, it's been a very rich evening, and I've enjoyed, as I sense all my colleagues around the table have enjoyed engaging with you and with your members' questions. Nursing is an incredibly rich and diverse profession, and we've touched on many aspects of that diversity of the profession this evening. But one thing that does bind together all the different disciplines within nursing, I think, is that sense of vocation and that sense of commitment to the well-being of the patient, and through the experience that we've had in our communities, and some of us have had on a personal basis in recent times, that's been underscored. It is absolutely essential that we have a greater degree of active recognition and respect of the sacrifices that your members, the length and breadth of Wales and beyond, actually make every single day in terms of what they do for us and for our health and well-being. So in a whole host of reasons, the issues that we've discussed this evening, from safe nursing standards to nursing bursaries, to issues of continuous professional development for nurses, which my party is committed to enhancing, we must ensure that we work across the aisle. And I think that will be more important in the coming Parliament, in the coming Senedd, than perhaps it has been ever before. We need to commit to doing our utmost to improve the lot of your members, because if they are better, happier, healthier, and more content in their work, then we're all the beneficiaries of that. Diolch yn fawr iawn. Thank you very much.
Diolch. Mabon, over to you next, please.
Yes, it's not often we get an opportunity to thank the medical staff that help us, and this is an opportunity that I have now, so I'll take it, and thank you all for everything that you have done to help my family and to help my community and to help everybody out there. It's said quite a lot, that we appreciate the medical staff and nursing staff, but it's now time that we stop the talking and actually show that appreciation. That's why we'd like to help out and ensure that the stress levels aren't what they are by recruiting and training more nursing staff, not just for our hospitals, but especially also for community nursing staff as well. We'd ensure increased pay and better terms and conditions, because that's what you've been telling us over the last decade and more, and someone now needs to step up and listen to your voices. We will also need to ensure that there are counselling services available for you because of the huge stresses that you have been put under and that you're continuously under, especially for mental health services. Giving social care staff that same parity of terms and conditions as the NHS is also something that we would have to do, and also free continual professional development for yourselves, so that you see that there is a future in the career of nursing for you. So, now it's time to stop the talking and actually take some action, and that's what we'd like the next Welsh Government to do, is listen to you and work on your behalf. Thank you very much. Diolch yn fawr.
Diolch, Mabon. And finally, Jackie, please.
Thank you, first of all, to Anne and for Nicholas for the chairing and for the questions, and also for all attendees. It was absolutely a pleasure to be here tonight, and to all the panelists as well. Thank you so much. these hustings. Now, we've only got like 30 odd seconds remaining. What I would like to say on behalf of Welsh Labour is that Welsh Labour, of course, Labour is the party of the NHS and will remain the party of the NHS to protect the NHS and the services that it provides, and not to privatise further the NHS at all. And I do think that that's an important point to make. There will always be more that we can do, always more that we can, how we can value people, including nurses and the nursing profession and trade unions. And the Welsh Labour government, if returned in May, will, I'm sure, in the manifesto commit to that, valuing nurses, not just in terms of pay and according to the independent review, but also in the whole package of measures that I was outlining earlier on about a holistic approach to the working life of nurses in particular. Now, we'll see what happens on the 6th of May, but certainly from my personal point of view, we always say thank you, and okay, you've heard that a million times, you want to see action, and I will take that back as a message. And certainly the film as well talked about more community nursing, and that is absolutely a fantastic little video that was presented here and is the message. We need to value the NHS. We need to value those people who work within it. It doesn't matter who they are. But in particular, we need to value human beings, and for all of us to be able to live in dignity. And what does that look like? I believe that looks like a fair living wage, terms and conditions that we can live by and with, a balanced family life, and overall quality of life. And I think that's invaluable, actually. And that's, if I were elected on the 6th of May, that's what I would fight for within the NHS and outside as well. Thank you so much for your time. Really appreciate it.
Thank you very, very much, Jackie. And thank you very much to everybody that's been here tonight, and Nicholas especially for keeping us in order there. I am going to say something sort of slightly off script. I'm a sort of semi-retiree, just doing union work mainly, but now vaccinating. So I want you all, please, regardless of party, yes, but I want you to actually go out there and actively tell people that this is the way forward, and that we want you all to be vaccinated, you know, regardless of what. Vaccination is the key at this moment in time, and we've still got a lot to do and a long way to go. And I think that is my apolitical aim, but I think that's something that you should all be putting forward to everybody that you speak to. Thank you very much, everybody. Good night. Nos stau.